Hello, everyone. So, my name is Zoe Frederick, and today I will be presenting my pharmacology project on Addison's disease. Specifically, Addison's disease and its treatment focuses on hydrocortisone, which is the primary drug which is used in managing this condition. This presentation will briefly go over the disease's definition, its causes, their systemic and oral effects, and as well we'll go over an in-depth look at the drug treatment, which includes the mechanism of action, pharmacokinetics, interactions, and adverse effects. I will also wrap up the preventative oral strategies relevant to dental hygiene care itself. So, with that being said, what is Addison's disease? Addison's disease is also known as primary adrenal insufficiency, which is a rare endocrine disorder that occurs when the adrenal glands pretty much fail to produce adequate amounts of certain hormones. The hormone is primarily cortisol, and in some cases, it can be aldosterone as well. Cortisol is a glucocorticoid hormone that plays essential roles in regulating metabolism, immune function, and the body's stress response. Adderall, or aldosterone, is also a mineral corticoid responsible for pretty much maintaining sodium and potassium balance as well as blood pressure itself. Without enough of these hormones, pretty much what the body does is it becomes unable to respond to stress properly, and it cannot maintain essential homeostasis, which can lead to a wide range of systemic and oral symptoms, which I will also discuss in some of the upcoming slides. So pretty much the etiology of Addison's disease, which is the most common cause, happens to be the autoimmune destruction of the adrenal cortex, which pretty much means that the body's immune system mistakenly attacks and damages its own adrenal tissue. Other causes can also include infections, such as tuberculosis, which is used to be the leading cause historically for Addison's disease itself. But now they're finding that fungal infections, or HIV/AIDS, are also more commonly associated to Addison's. Genetic factors, which some patients can inherit disorders like autoimmune polyendocrine syndrome from this. And then another etiology could be cancer, specifically metastatic cancer, which spreads to the adrenal glands themselves. And then certain medications, which particularly long-term corticosteroid use is followed by, it can be followed by sudden withdrawal, which can also result in adrenal suppression and insufficiency. With that being said, all of these contribute to hormone deficiency, but autoimmune causes remain pretty much the most prevalent, especially in even developed countries as well. So, when taking a look at the effects of this disorder on the body, Addison's disease affects multiple systems in the body, which most common symptoms can include fatigue, weight loss, low blood sugar. It can also contribute to hyperpigmentation of the skin, particularly mainly seen like sun-exposed areas and skin creases, which are due to elevated levels of ACTH, which is also another hormone. Salt cravings, nausea, and abdominal discomfort can also be an effect, which perhaps most concerning, I would say, is the risk of an adrenal crisis. And so pretty much an adrenal crisis, it can occur when cortisol levels drop dangerously low. And this can lead to a lot of confusion, it can lead to dehydration, and it can lead to actually even dangerously low blood pressure, which can often lead to either a death or coma. If it's not treated immediately, obviously that's not ideal. So it's definitely something that pretty much really needs to be taken seriously. These range of symptoms can also progress slowly and be mistaken for other conditions, which is why the diagnosis is often delayed or even missed for most people. So moving on, in addition, systemic symptoms, Addison's disease can also have a distinct oral health implication, which is important for us as dental hygiene professionals because a lot of common oral manifestations can include hyperpigmentation, and patients often develop dark patches on the oral mucosa and the tongue and the lips. And pretty much this can happen for the same reason as skin pigmentation increases, which is due to the elevated adrenocorticotropic hormone, which again is ACTH. This can also lead to delayed healing. Because cortisol supports immune and inflammatory responses, its absence slows down healing. So wounds in the oral cavity may persist longer, which leads the patient into a more increased risk for oral infections. A suppressed immune response can also lead to opportunistic bacterial or fungal infections as well. And then, of course, xerostomia, which is dry mouth. This is likely due to aldosterone deficiency, which can disrupt fluid and electrolyte balance, which leads to decreased salivary flow, obviously, dry mouth. And so these issues not only can affect the oral comfort of a patient, but it also raises the risk for just decay overall and periodontal problems. So, drug treatment for Addison's disease, the cornerstone for Addison's treatment is pretty much lifelong hormone replacement therapy. And the primary medication prescribed for Addison's disease is hydrocortisone, which is a synthetic version of cortisol itself. Hydrocortisone is taken about probably 2 to 3 times per day, which actually pretty much mimics the body's natural cortisol rhythm. And so it helps restore normal metabolic immunity, stress, and just overall our body's response, which is affected. So prednisone is another corticosteroid that can also be used in some cases, not all. And pretty much it has a longer half-life than hydrocortisone, and so it may be preferred for only using once a day. After it's taken orally, it does get converted into prednisolone in the liver, which also actually produces the therapeutic glucocorticoid effect. And so even though both these drugs are very effective, hydrocortisone is preferred mainly due to its similarity in endogenous cortisol, which is our natural cortisol levels. So when it comes to the mechanism of action, the hydrocortisone, how it pretty much works is that it mimics cortisol, obviously, and that is a natural glucocorticoid hormone, which once in the body, how it interacts is it binds to intracellular glucocorticoid receptors, which are also commonly found in target tissues like the liver, immune cells, and fat. These kind of bindings pretty much influence gene transcription and then leads to the production or suppression of specific proteins. Throughout this process, hydrocortisone helps also regulate metabolism, stress, and immune function, and it can also help reduce inflammation. It suppresses immune activity, which is especially helpful for autoimmune forms with patients with Addison's. It also pretty much it replaces the deficient cortisol in the body, which our body is no longer making. And so this mechanism, what it does is it gives hydrocortisone both its anti-inflammatory and immunosuppressive effects. And so it pretty much just helps our patient, be able to function on a daily basis. And so when it comes to the pharmacokinetics of the drug itself, which we call ADME, which stands for absorption, distribution, metabolism, and excretion. Pretty much absorption, hydrocortisone is very well absorbed orally, which usually reaches its peak plasma concentration within about an hour. Distribution of the drug, once it's absorbed, it's widely distributed throughout the body, and it binds to plasma proteins like albumin and transcortin. And when it comes to metabolism, the drug is primarily metabolized in the liver, just like most things, and it's metabolized by enzymes, which eventually become converted into inactive metabolites. And lastly, excretion. These metabolites are then pretty much excreted through the kidneys and primarily in the urine. So this profile pretty much supports the overall routine of oral dosing for this drug, especially when it's taken multiple times per day, which also again help mimic the natural cortisol cycles. For drug interactions, hydrocortisone can interact with several other medications, which is actually why it's so important to keep in mind when managing these patients as a dental hygienist. When going over a few drug interactions, phenytoin, this anti-seizure drug, pretty much it induces liver enzymes, which also speeds up hydrocortisone metabolism and makes it less effective. Ketoconazole is actually something that is an antifungal and it inhibits hydrocortisone metabolism, which also increases the drug's toxicity. And then, of course, NSAIDs like ibuprofen and aspirin, when those are combined with corticosteroids, they increase the risk of gastrointestinal ulcers and bleeding. Warfarin is also another hydrocortisone, which can affect the anticoagulant effects of warfarin, and it increases or decreases clotting risk. And lastly, when it comes to diuretics, such as furosemide, these can cause potassium loss, which also worsens the electrolyte imbalances already that is present in Addison's. And so pretty much corticosteroids, they raise blood sugar, so they can counteract diabetes medications. And because of these risks, patients on corticosteroids should have, they should be very carefully monitored and have a good medication regimen. When it comes to the adverse effects of Addison's disease, I'm just going to kind of cover the most common effects, which is especially with long-term use, the GI irritation or ulcers, especially when taken with NSAIDs. Another really common one that's important is hypertension. This is due to sodium retention, and your mood can change, insomnia, it happens. Your increased susceptibility to infections can occur, and just overall, immune suppression. It really is important to take note that these effects are dose dependent, and they do tend to occur with prolonged or high dose therapy. And so that's why Addison's patients are generally kept on the lowest effective dose to help manage these symptoms. As dental hygienists, one of our roles is to help manage and prevent oral complications in patients with systemic conditions. And so here is pretty much kind of like a breakdown of just simple preventative strategies that are focused more on oral manifestations. And mainly, I would first encourage excellent oral hygiene care at home, especially brushing with a fluoride toothpaste and using antimicrobial rinses to help lower the infection risk. Obviously, recommended regular dental visits. And if the patient does experience xerostomia, I would definitely suggest a lot of hydration, saliva substitutes, and limiting alcohol as much as they can. Also limiting spicy or acidic foods, as these can also irritate and dry the oral tissues. So overall, to wrap things up, Addison's disease is a rare condition that is pretty much caused by primarily adrenal insufficiency. And so often, due to these autoimmune destruction of the adrenal glands, it is treated with corticosteroids, which mainly hydrocortisone again, and occasionally prednisone. While these drugs are still life-saving, they do come with potential interactions and side effects, which can need to be monitored, and addressed, especially as a dental professional. Our focus is on recognizing oral signs and preventing, preventing care and supporting the patient's just overall health. And when it comes to references, this slide is obviously all the references that I was able to use. And thank you guys so much for listening. I do appreciate it. And if you have any questions, let me know. Thank you.